Parent right now, you are busy. You're getting school supplies, you're firming up the fall family schedule, and something that really seems to happen right after school starts, your child will get sick.
Been there, done that, right? Yeah, here you go. It's not always just a common cold either. Sometimes a more serious respiratory illness like COVID, the flu, even RSV. According to health experts, now is the time for parents to prepare. In this health alert, Brittany Schmidt tells us why prevention is key.
COVID-19, influenza, and respiratory syncytial virus, also known as RSV, all caused by different viruses, but all can be prevented with similar actions according to health experts. Proper hygiene, washing your hands and covering your cough, testing and staying home when sick, and getting vaccinated.
But we have more tools than we've ever had to help people keep themselves healthy and safe.
Dr. Ryan Westergaard with the Wisconsin Department of Health Services says the newer strains of COVID-19 circulating right now don't appear to target kids and don't cause severe illness, but it can spread to those more vulnerable. The state is seeing a slight uptick in COVID-19 hospitalizations right now, still well off pandemic highs. A new COVID-19 vaccine should be ready in early October.
The United States and Wisconsin DHS is preparing for a fall vaccination campaign that uses an updated vaccine that was developed to more specifically target the Omicron variants that are currently in circulation.
Another respiratory illness we talk about every year, RSV.
It's the #1 cause of hospitalizations among infants in the United States and causes a significant number of infant deaths every year, particularly in those that are born prematurely or have other medical conditions.
Westergaard says earlier this summer, the FDA approved 2 new RSV vaccines for use in adults 60 and older. Just a couple days ago, the FDA approved one of those vaccines for pregnant women so their babies can be born with the protection. The CDC has not made its formal recommendation just yet.
I think we'll see that soon, but it's another example of new tools that we have to prevent severe disease due to respiratory diseases.
Westergaard hopes Wisconsinites do their part to prevent illnesses as the state continues to track trends through hospitalizations and wastewater management. In Green Bay, Brittany Schmidt, Action 2 News.